Hi everyone. Today we'll tell you a bit about the role of robotics in GI and liver and pancreatic cancers. At Nanavati Max Hospital over the last few years, we've been routinely doing a lot of robotic surgery. Which are the cancers where we do this commonly? What is robotic surgery? How does it work? And does it really have any advantages over conventional surgery? So robotic surgery is basically an advanced form of minimal access instrumentation. It's an advanced form of laparoscopy. It's an advanced form of keyhole surgery. So a robot is a large instrument which is parked at the bedside of the operating table. This robot has 4 arms, and these arms will carry certain instruments which are completely guided by the surgeon sitting at the console in the same operating room. So when I'm doing a robotic surgery, I'm at the console and I have one colleague of mine, one surgeon who is at the table to help with certain instrumentation, removing instruments, putting them back in, suctioning, putting in staplers, etc. So the robot is completely controlled by the surgeon who is operating at the console. So some people have the misconception that if the robot is operating, is that safe? But the robot is completely controlled by the surgeon and it is nothing but an advanced form of instrumentation. So what are the advantages of robotic surgery? It provides excellent magnification. The magnification is much more than what we see in laparoscopic surgery, almost 10x magnification compared to the naked eye. So we are able to see small structures, we are able to see small blood vessels, small nerves and preserve them. And that makes a huge difference. The advantages over laparoscopic surgery, which is also a keyhole surgery, is that it provides 3D magnification. We are able to see everything in 3 dimensions. It is as if we are inside the abdomen, so it marries the advantages of open surgery and laparoscopic surgery. What it also does is that it gives us angles that we don't get in any other form of surgery. We are able to visualize the same organs from different perspectives because the robotic camera is completely controlled by the surgeon and we can take it anywhere inside the abdomen. And that has really changed the outcomes of these surgeries. So some of the common surgeries that we do almost every week is a rectal cancer surgery. This is one surgery where it has really changed outcomes for patients. For starters, it has increased the amount of sphincter sparing, meaning that patients who would otherwise require a permanent colostomy, after robotic surgery, we are able to dissect so much lower and yet spare the sphincter, get into intersphincteric planes. It's really made life much easier and we are able to save more and more sphincters. Second, it is able to magnify structures which are not seen by the naked eye. So nerve sparing is much better. Patients previously after rectal surgery would have a lot of issues with bladder functions and even sexual functions. And we are seeing a lot of young patients with colorectal cancer, so this becomes very relevant. And with robotic surgery, the nerve sparing is much better. And because of that, we are able to save bladder functions and sexual functions in more and more of these patients, and thereby ensuring that they have almost normal lifestyles after the surgery. It's also got various features, new technologies, ICG, which helps identify the blood supply of the 2 ends that we are joining, making it much safer. We have robotic staplers now, which go in different angles, which make stapling much easier. So overall, this technology has really helped improve qualities of rectal surgery. Same with colonic surgery. We are seeing a distal pancreatectomies with robotic surgeries, sometimes even liver resectionals. But it is very important to choose the right case to do with a robotic surgery. Just because we have a robot, it doesn't mean every case is good for robotics. It has to be balanced out with safety. It has to be balanced out with oncological outcomes. But in the right patients, it's a great tool and it really has impacted patients in a positive way. Most patients after a robotic surgery, the next day are walking around and by the 3rd or 4th day are ready to go home. And that's a huge change compared to any other the conventional forms of surgery. So robotic surgery is here to stay, and with time, I think more and more surgeries will be done robotically, and I think it's a huge advance in medical science. Thank you.